I'm going to present on DATAMIND, which is the new mental health hub on behalf of myself and Anne. This is us sitting in the infrastructure, all happy and set up. So, we set up in September, so I'm mostly going to be presenting about aspirations and how we've set ourselves up and what we look like. We're quite a broad network, as you can see from the map. So we cover all 4 nations and a lot of sites. So that's been very much a feature of us. It's almost more of a network grant than a hub grant in some ways. And this was because of where we were when we were bidding for this. Mental health data science has been going on for a long time. Longer than HDR UK existed. This is quite a mature specialty in many respects, and the sites that are involved in this have been doing this sort of work for quite some time. And the great thing about the hub is the chance to kind of bring everyone together and put the sort of coordination on top of that. So we're investing in a lot of existing resources. The map there shows the blue sites were all recipients of MRC money as part of their Data Pathfinder program for mental health that was a few years ago. And most of those sites then sort of became our hub. We added Northern Ireland and Manchester, and we've sort of grown it, which is great as well. So we're building on existing networks and activities. We're building on a lot of sort of previous investments and expertise. And also, crucially, we're building on a lot of previous PPIE. We've been doing this for a long time. Mental health care, you have to involve patients. It's crazy not to, or to attempt any mental health research without very strong PPIE. So this is something that's sort of inbred into the way we do things in our specialty. And so we'd had a lot of mature PPIE going on, and it's again great to kind of build on that combined expertise. In terms of what we're trying to do, we're sort of developing capacity, and MQ, our charity partners, been particularly involved in this, again, for a long time, getting on for 10 years now, funding, pump priming mental health data science research. So we're broad and multidisciplinary and highly connected. And I guess the key thing that we're looking for at an early stage is connectivity to you lot, to the other hubs, because mental health obviously exists alongside and integrated within a lot of other specialties. And so that's something we're very keen to develop. And we adopted very much a federated TRE approach. We didn't sort of go in there imposing one TRE or saying we're going to build one TRE, because in our space there are already numerous of them, and so the main thing is to get them working together and interoperably. This is us, this is the leadership, so Anne's the boss, and she sends her apologies, and then the rest of us, again, all people working in the field for a long time. When we put the bid together, we all knew each other well from previous activities, so it was a very easy and smooth thing to do. In terms of objectives, there are no particular surprises. It's the fairly sort of obvious things. So embedding patient personal experience into the process, being guided by and responsive to the need of users, making data sets available and visible and accessible, curating and enhancing interoperability of data, global standards for industrial research and development needs, and supporting capacity development, building up our junior complement. And this is the sort of structure of our hub overall. So again, our core activities, again, are not very surprising, much the same as all of yours. So public participation, very much sort of up there as number one. And this relates particularly to industry involvement. A key task for us is to get a clear view from patients and the public about mental health data, which is, obviously sensitive, and there's particular sensitivities around industry use of data, and we want to try and find a way forward through that that's led by our PPIE component. And then you've got sort of fair curated data, trying to make the data available, and there's a lot of it around, business development, sustainability, and capacity development. And across that, we've got some key challenge areas. Children and young people, for obvious reasons, excluded and underrepresented groups where data science can particularly help. Interfaces between physical and mental health, very important for us, and again, another reason that we're particularly keen to interface as much as possible with other hubs and other activities, and severe mental illness as well. And in terms of how we're going to sort of deliver what we're delivering, the first milestone is around making data sets available. We've got a lot of data sets. We already are making these available, and we already were making these available, led by my colleague Louise Arsenault. We have a catalogue of mental health care data sets. And the key thing for us has been to sort of try and harmonise that with the HDR UK structures and the gateway and everything. And then what we wanted to do, as well as these sorts of core objectives, was to actually push forward mental health data science, thinking about the needs that we have in our sector. And so we incorporated in the grant a kind of sort of 6 sprint projects. So one of them is Discoverable Schools. Emergence of mental health in childhood and adolescence tends to be known first at the school stage before anyone comes anywhere near healthcare. So you have to work with schools if you want to understand the emergence of many of these mental disorders. Excluded and underserved population. Anne is leading that, very keen on this idea that we can use data science and routine data to identify people who don't usually appear in research studies and to get knowledge on their issues. Linking physical and mental health, I've mentioned. Reusable free text data. This is again something we've been doing for a long time. That's an initiative that I'm leading locally at King's. We've been doing this for over 10 years, using the free text of mental health care records, applying natural language processing to that, simply because we have to, because in mental health research and mental health care data, we don't have much structured fields that are of much use, so we've had to work with the text. If you go to our stand out there in the exhibition area and pick up one of the lanyards, amongst all the various research papers is the catalogue of natural language processing algorithms that we've developed at King's and that we're trying to make more available, and there's at least 100 of them on the catalogue at the moment, looking at various aspects of mental health and mental health care. And then the other one's digitally enhanced trials, led by Manchester, and drug discoverability, led by Edinburgh for obvious reasons. So we have a lot of resources. As I mentioned, it's been going on a long time in mental health. So we've got some very mature cohorts out there that are extremely informative and have been extensively used, and that we're trying to bring together and make more available, make better as part of this hub. We've got bioresources like everyone else. And mental health in England was the first sector after primary care to have electronic health records, quite a way before acute trusts went paper-free. Mental health trusts were sort of forced to by the government at the time, but it had sort of fringe benefits. So we've used healthcare data in our own trusts for a long time now, and that's again a sort of mature field. And then we've obviously, as you've got all the sort of opportunities that are available through linked administrative data, education data, benefits data, all these sorts of things which are very important to mental health research. And then other things like geospatial data, social media trends, and these sorts of other information sources that are important to bring into the pot. I think the challenges for us are probably much the same as for you. It's about sort of how to harmonize without restricting, so how to kind of create sort of, interoperability without sort of forcing people into sort of ways that remove the truth from the data. Making data accessible beyond simply discoverable, so actually making sure that the data are easy to use and not just simply saying, well, here they are, get on with it, but actually sort of enabling research to happen. Developing the linkages and networking these and trying to kind of sort of create things that are more than just one site linked to something else, but sort of getting that into a multi-site framework. I've mentioned natural language processing. That's key for us in terms of data depth and visibility in the healthcare record sector, and a key challenge for us. And then I think there's also this sort of local-national dichotomy is sometimes can be a bit of a problem. So we've got sort of very deep local resources, and we've got these kind of quite thin national resources, and there ought to be a middle ground where you can sort of replicate up some of these local resources so that they become multi-site. So to try and enable that sort of data that's both large and deep to complement the national resources that there are around. And then finally, progress to date. Well, simply we started in September. We've been getting underway. We've been focusing particularly on the core activities and getting our contracts sorted out and staffing and all the rest of it. We've begun the process of setting up public participation group, a meta group that's going to cover the whole thing, and they've started meeting, and they're starting to kind of generate information that's going to feed into everything. The fair curated data, as I say, we've already got quite a lot of that up and running already. It's just a matter of working out how to interface that with the gateway and bring it into the HDR UK infrastructure. Business development and sustainability is well underway, as is we've begun sort of workforce capacity training and development as well. So we're looking forward to it. We're obviously just new starters and not yourselves jaded and sort of, so, you know, we're sort of still full of enthusiasm and drive and looking forward to the next few years as we move this forward. Thank you.